everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So today, we are here to present Detect to Protect, a series of awareness session in the fight against breast cancer. So today's session will explore the vital insights on breast cancer from recognize the sign and symptoms to the importance of early detection, prognostic testing, and the latest treatment options. So, before starting with the discussion, I would like to share some facts about the breast cancer prevalence in India. Breast cancer has emerged as the most commonly diagnosed cancer in India, surpassing the cervical cancer, with approximately 178,000 new cases reported in 2020, according to Global Cancer Observatory. The disease accounts for around 90,000 annual deaths, highlighting the significant challenge in early detection and access to the treatment. Notably, breast cancer affects younger women in India, with many cases diagnosed in those who are under 50. Incidence rates varies globally, with urban areas experiencing higher rates due to lifestyle changes and better detection methods. The 5 year survival rate is around 60%, but this varies significantly based on the stage at diagnosis and treatment access. Increasing awareness and screening programs are vital to improving early detections and outcomes, supported by both government and non government organizations across the country. To begin with the discussion, first, I would like you all to please join me in welcoming our expert who is going to provide us with insightful information on understanding about the breast cancer awareness. So I would like to welcome Dr. Peush Bajpai, HOD and Consultant, Medical Hemato Oncologist, Manipal Hospital, Delhi. Welcome to the discussion, Doctor.
Thank you, Dr. Sumedha, for having me over here on your platform.
You're welcome, Doctor. So, in this session, we'll explore about the critical early signs and symptoms of breast cancer, delve into the powerful world of screening by highlighting the mammograms and other essential tools for early detection, and uncover the vital role of prognostic testing in breast cancer care, and revealing how it helps predicting the disease trajectory and shape personalized treatment strategies. So, let's delve into the discussion. Dr. Piyush, I would like to know your views on about like what are the reasons of increasing in breast cancer incidences in India, and what is the difference in incidence between rural and urban population?
So, Dr. Sumedha, the breast cancer, as we see, is increasing every year. The numbers are uh, what we see the previous year and then this year. There has always been a rising trend for the past 5 years, I think so, except for the COVID period where the incidence capture was not so accurate. But otherwise, there has been a trend which is increasing. And the major part of this is the urbanization of the lifestyle, which is actually taking place. So when I say that, then there comes into play metabolic syndrome, uh, which is actually increasing. Metabolic syndrome, when I say to make your viewers understand better, obesity is one of the important aspects, and along with obesity, the other disease patterns like diabetes, hypertension, hyperlipidemia, PCOD. So all these factors basically are somewhere related to metabolic syndrome, which eventually is related to the food we eat, the way we are actually leading our lifestyles. So which is a very hectic paced lifestyle and with a lot of stress. So all these factors are contributing to various cancers, and breast cancer is, of course, quite closely associated with metabolic syndrome or obesity. The second aspect, of course, is that there is better health services now, better screening programs, which are also coming up in India. And the urban population is having now accessibility to the healthcare which is there. So they are approaching the healthcare, and the capture rate of such individuals which weren't being captured earlier. So that is one thing, because the awareness is increasing. So more people who were not being, who were actually not coming forward are being detected with cancers. So it is both that one, the lifestyle patterns which are attributing to increase in breast cancer. And the second, that healthcare has become more accessible. People are coming forward for screening, and that is leading to increase in rates. But I think so. The first one cause is more disturbing, and we need to sort of discuss that because it's really preventable and makes a direct impact on the society. Number two is what you just said, that the difference between the urban and the rural patterns. So of course, as we see that the differences between the urban and rural are slowly eroding, because what food we are eating in urban is
Yes.
eventually the rural. India is also now, with the all the access available, technology available over there. So the patterns are changing. But nonetheless, breast cancer continues to be the top cancer in the urban part of India because of more obesity and more metabolic syndrome associated, and of course the reason that more catch rate is there. In rural India, the number one cancer still is the CS cervix. So in ladies, so breast cancer is second in number over there. So this is probably the reason that lesser urbanization of food habits, fast food is less prevalent in rural India, and but nonetheless it is sort of catching up, I would say. So for now, breast cancer is number two in rural India, but number one in the urban part of India.
Thank you, Dr. Piyush, for these insights onto that. Moving ahead with the discussion, I would like to know, like, what are the most common early signs of breast cancer that people should be aware of? If I talk about in a layman language.
Okay, so the early signs of breast cancer, when we see early breast cancer, so usually a lady would present with a painless lump in the breast. The lady would be usually, I'm talking, is in her fifth decade of her life, and that is above 50 years most commonly. Uh, and it would be like the lady would present with a painless lump in the breast, and this lump basically would be eventually having a growth rate. If she would have been observing this, that is from a pea size to slightly larger, she would have, she would record this history. Sometimes ladies present with a history of nipple discharge, which is bloody nipple discharge specifically, and a bloody nipple discharge is more of a concern. One of the most common signs which ladies should know is the change in breast contour, the difference between the discrepancy between the two breasts. So if a lady is examining or having a good idea of her breast contours, so if there is a change in there is a asymmetry, that is one breast starts appearing smaller over a period of time after this particular age, 40 or 50, then a proper self breast examination can actually help in catching early breast cancers, which would be largely painless, could have a nipple inversion or a nipple discharge. The overlying skin over the lump might be free or might be having a pudy orange appearance, what we call as orange peel appearance. That is, there would be small puckered, small puckered shape holes which could be there. Not exactly holes, but puckering of the skin could be there, or the feel of what a orange peel has. So the skin could be overlying the lump, could be having a orange peel sort of appearance, a look, which could be there. These are the local signs. Sometimes the lump might not be quite overtly felt in the standing position, but it might be felt more so in the lying down position with the opposite hand. So that could be thing. Another thing is that patients sometimes present a lump in the armpit, so that could also be there. because that's the first site where breast cancer usually spreads to the lymph nodes. So it's not just the breast, but also the armpit, examination of the armpit, which is a very important thing in self breast examination. So basically, it is a painless lump. It could be nipple discharge, especially a bloody nipple discharge after the age of 40 or 50. It could be the overlying skin, which is rough, like an orange peel, and with small dots, like like the what the orange peel has. And then it could be like the asymmetry of the breast, especially if there is an underlying lump or the skin is sort of puckered. So that could be, these 4 or 5 signs are the most common signs what we get to see. This is about the local breast cancer, loco-regional spread. That is, the breast cancer is still in its early stage. Sometimes we get to see that people present in especially the first manifestation would be like a back pain, especially in elderly ladies. And there, in retrospect, we examine the breast as, when we see the patient. So sometimes we realize that there is a breast lump, so which is sometimes not brought into the notice because ladies could not really appreciate that particular lady could not appreciate that there was a lump in the breast. Especially such age group is usually above 75 years of age, 80 years of age, who aren't quite aware that, okay, such a lump was there. And until unless you start having a back pain and get an examination done. So no any new symptom in this particular age, especially above the age of 50 years, should be brought into the notice of their family physician, so that further proper workup can be done.
Thank you, Dr. Piyush, for these insightful information onto that. And I think this is going to help out the people really into like self screening themselves. Moving ahead with the discussion, I would like to know your view on like the current guidelines, if I would say the Indian guidelines for the best breast cancer screening, including the age recommendations and frequency, and how these might vary based on individual risk factors.
Yeah, so you asked a very important question, and that's what we are talking about. That the breast cancer war is to be fought on two fronts. One is, of course, changing your lifestyle. That's the primary prevention. We all should advocate to adopt the primary prevention. Eating healthy, and sleeping well, and regular exercises. And the second aspect, what you ask, is detecting it early, and detecting it early to an extent that we can actually change the trajectory of how the disease could behave. So talking about the various screening aspects in Western world, basically what is advocated, it is basically a self-breast examination should be done, and that's for the Western or the Indian. So a self-breast examination by every lady should be done, and that this should start as a habit from the age of crossing the teens. So every lady should start doing a self-breast examination. The best period to do a self-breast examination is the mid-cycle. So the mid-cycle is the most appropriate period. Now, self-breast examination, various protocols are available. One is, of course, standing in front of the mirror and in the standing position. One is, as I said, that sometimes while after lying down, you could appreciate the breast better. Now, the self-breast examination things are that it is done with the opposite side of the hand. So if the left breast is to be examined, the right hand is to be used. And the palmar surface, that is the not the fingertip, it should not be a poking thing, one should keep in mind, but the flat of the fingers should be used in palpating the breast. The breast should be palpated in the circumferential manner, and please also, one should palpate the armpit. So armpit is also very important because that usually is left out. Should be done on a very periodical monthly basis by every lady. So this can pick up small lumps. Now, talking about the next thing is, of course, the clinical breast examination, and that's again both for the Western and the Indian world. So it's once the lady goes to their gynecologist, especially during the antenatal checkup or for some other reason, it's basically the duty of the doctor And also the lady should come in forefront to get their breast examined by the gynecologist, so that any such lumps could be detected and brought into notice earlier. So a clinical breast examination by a trained physician should be done once in at least 6 months. So whenever the lady is visiting the gynecologist, this particular test should be done. And this is not a test, but just a physical examination. The patient should be on the couch and the doctor examines the breast. And then once after the age of 45 years, now the American Cancer Society, they recommend that to do a mammogram on an annual basis, at least till the age of 55 years, and from 45 to 55 years, and then do it thereafter once in 2 years, and continue till the age of 70 years, or probably if the lifespan is more than 10 years, then one can continue. But the more important thing is that in the Indian scenario, a clinical breast examination should be done by the physician or the family physician or the gynecologist whenever the visit is being made to her. So that is very important. If the mammogram can be done, please go ahead, do a mammogram. As I said, that between the age of 45 to 55 years of age, a mammogram once a year, along with clinical breast examination. So it's not just the mammogram alone. A clinical breast examination should also always be accompanied with a mammogram. And then, eventually after the age of 55 years, one can actually go slow and do it once in 2 years till the age of 70. Below 45 years, if there is any doubt, usually the challenge below 45 years is it's a dense breast, and therefore mammogram might not be might not end up very conclusive, and therefore ultrasound of the breast is more relevant over there in this particular age group. Sometimes ultrasound is also required between the age of 45 to 50 years of age as well, when once the density of the breast is still there. So you might have to then complementarily actually look at mammogram as well as ultrasound, both of them. So this is what it is. But whatever, these investigations are harmless. They do not cause any radiation, excessive radiation. The very small radiation over here, which is there in the mammogram, they are easy in terms of doing it. Of course, it requires that it should be done in the mid cycle and not once the menstrual cycle is going on, because then it could be a painful, discomforting investigation. Otherwise, these are doable and take a very small time, and once a year.
Thank you, Dr. Piyush, for providing the insights on the guidelines for breast cancer screening. And I think this is going to be really important to the people who are listening to this. Moving ahead with the discussion, I would like to know your view. Like, how can someone differentiate between the benign breast changes, or I would say the potential cancer symptoms?
So benign breast changes, basically, what are there are basically the most common benign breast changes are fibroadenomas. These are nothing but glandular growths in the breast. So breast, as we understand, is a gland, is a milk producing gland, and therefore these glandular there would be glandular changes with each menstrual cycle, and there could be these lumps or small lumpy swellings which could come up with each cycle, and they are nothing but glands, and they sometimes aggregate together and form this particular lump, and this is called a fibroadenoma or a breast mouse, which actually slips under the finger basically. But the doctor should examine and take this call whether this is a fibroadenoma. The other typical thing is a cyclical mastalgia. So the breast having, if there is bilateral pain in the breast, usually this is not related to cancer. So sometimes ladies come to us that there is pain in both the breast, and this is usually a benign situation. It is not cancerous usually. These ladies are usually young, and they have pain in both the breast, and it's usually varying with the menstrual cycle. So it's a waxing and waning sort of pain. So this typical sort of pain is typically because of the hormonal changes in the body in each menstrual cycle. Uh, Fibroadenoma, as I told, and cyclical mastalgia, as I told, are two major benign conditions. Then there are other benign conditions as in fibroadenosis, so which is again a extension of fibroadenoma. So these benign conditions basically should be one can discuss with the doctor always. But if in case the pain is unilateral, that is one side of the breast, there is pain. So 80 to 90% of the times breast cancer will be painless, or a lump will be painless. So that's what is very important to note, that ब्रेस्ट कैंसर में कभी दर्द नहीं होगा जो शुरुआत में अगर होगा. So it's early breast cancer lump will be usually painless in 80 to 90% of the time. But still, if in case there is unilateral pain, then again the medical checkup should be done to find out what is the cause.
Thank you, Dr. Piyush, for the insights onto this. Moving ahead with the discussion, as our campaign theme as detect to protect. So I would like to know your views on like how early detection of breast cancer lead to the change in the results, I would say, on maybe the treatment options and the recovering rate.
So early detection in every cancer, not only breast cancer, can actually lead to number one, catching up it in early stage, catching up where once you catch up in early stage, you require lesser treatment modalities. When I say treatment modalities, I mean to say that there are three main treatment modalities in cancer. One is the surgery, the second is the medical therapy, that's the chemotherapy or oral hormones in case of breast cancer, sometimes targeted therapy in case of breast cancer, and third is the radiation therapy. Sometimes in very early stage breast cancer, you might actually end up omitting one or two modalities. So probably surgery might just suffice. Probably you can omit radiation therapy. So depending on the stage in which you catch breast cancer, not only catching early, you can come down on the number of modalities, that is decrease your treatment modalities as well as duration of the treatment. Also you can catching it early means you are using less of your resources, finances also. So the eventual cost of the treatment definitely comes down. And needless to say that early stage, the better the outcome is. So we see that stage 1 breast cancer, the outcomes are above 90 to 95% in terms of survival. In stage 2 breast cancer, basically there is a 10% fall, what we see at around 80 to 85%. And eventually in stage 3 breast cancer, it falls down further. So what I'm trying to say is that catching these lumps, painless lump early, probably one can actually catch them in a very early stage and can do accordingly and get treated well accordingly.
Thank you, Dr. Piyush, for the insights onto that. Moving ahead with the discussion, I would like to know like what all are the different type of breast cancer, and if we talk about the prognostic testing, so what should one layman understand about it, and what we all should know about this, and how does this help in the breast cancer treatment planning?
Okay. So usually breast cancer, broadly speaking, is divided into whether it's a hormonal positive breast cancer, because hormonal positive breast cancer is a major chunk of breast cancer, which we see in our population, and it is around in the tune of 60 to 70%. So nearly 60 to 70% of breast cancer would be estrogen and progesterone receptor positive, what we say as ER/PR positive in medical terms. This means that these breast cancers are basically the growth trigger in these breast cancers are hormones, the female hormones, and therefore, apart from the regular treatment of surgery and sometimes chemotherapy, sometimes no chemotherapy would be required. I would come to that. One can actually majorly treat these breast cancers after surgery with hormonal therapy. So hormonal therapy is just a pill. It's like a oral contraceptive pill, so it's got to be taken daily, and
Hmm.
this continues for a period of usually 5 years, sometimes 10 years, depending on the stage of breast cancer. So depending on this, these breast cancers, the 60 to 70% of breast cancer can be nicely treated with a oral tablet. So that's what is important to recognize, that which type of breast cancer is one dealing with. Then the other type of breast cancer is HER2 positive breast cancer. Now HER2 is an oncogene, and HER2 is an oncogene. When I say that, what does it mean? It's basically a HER2 is a protein on the cell membrane. Now, this particular protein is actually, manufactured or in the cell, where this particular protein is the driver front, which is actually responsible for, or is the growth engine of the entire cancer front. So HER2 protein basically drives the cancer growth. So if HER2 protein can be blocked, and there are now targeted drugs. So the targeted therapy, when we talk about targeted therapy in breast cancer, it is generally against this particular receptor. That's the HER2 receptor. The targeted therapies usually are trastuzumab, pertuzumab, and other targeted drugs. So HER2 is a very important. These are usually 20 to 25% in Indian population. So this drug can be given, and nicely the cancer can be controlled. Otherwise, these cancers are aggressive cancers and tend to spread. The other third type is triple negative breast cancer, where estrogen and HER2 both are negative along with progesterone. So
Yeah.
these receptors are negative. You do not find a staining of these receptors when we do the pathology examination. So these are called triple negative breast cancer, and these are in a tune of 20 to 25% in Indian population. And these are slightly more, I would say, as compared to the Western world in India. Now, this particular breast cancer usually is found in younger age group, in the age group of 35 to 40 years also. So here, and what we find is a small element of genetic inheritance as well, especially in the triple negative breast cancer. So genetic, as when I say, we all would have heard of this particular gene BRCA1, that is breast cancer related gene 1 and 2. So BRCA1 and 2 are these particular genes where we usually tend to see more of triple negative breast cancer. Sometimes ER positive as well, but most of the times triple negative breast cancer. These are aggressive cancers, and chemotherapy is one of the mainstay treatment of these cancers. So basically, this is how you subdivide cancer. So majorly, one is the ER positive, the second is the HER2 positive, and third is the triple negative. Now, when we talk about how we treat these cancers, as I said, for ER positive, it is surgery and sometimes chemotherapy, sometimes no chemotherapy. How do we decide? So there are tests to score that whether you really require chemotherapy in ER positive breast cancer, that is hormone positive breast cancer. And these tests are, for example, Oncotype DX or Prosigna, or uh, these DigiStain. So these tests are there, which actually help us in finding out whether the patient would really benefit, especially in early breast cancer setting where lymph node is negative. We will get to know whether the patient would really benefit with addition of chemotherapy, or hormonal therapy would be good enough. So Oncotype DX in particular is one particular test which helps us know this. Number two, the HER2 positive cancer, as I said, is basically targeted therapy where trastuzumab or its other family members, trastuzumab and drugs like that, where these would work. Now here, these breast cancers, you need to give them targeted therapy and chemotherapy before surgery. This form of therapy is called neoadjuvant therapy. That is, the therapy which is given before surgery is called neoadjuvant therapy. And this is very important, that one should not straight away go for surgery, especially for lumps which are more than 2 centimeter. So here we usually tend to do medical therapy first. And the third cancer, triple negative breast cancer, is of course the one where chemotherapy is of course there, and one of the most important treatment choices for this particular cancer. But immunotherapy is also coming in a big way. So immunotherapy and chemotherapy both are given, and then surgery is considered. So in the last two, what I just said, the HER2 and the triple negative, we usually tend to give medical therapy first and then do the surgery.
Thank you, Dr. Piyush, for these insights onto the treatment option part. So, in conclusion, our objective for today's discussion was to explore and emphasize the importance of breast cancer care by integrating insights on recognizing the signs, symptoms, and the significance of early detection, prognostic testing, and the latest treatment options. And I would like to extend my gratitude to Dr. Piyush for his insightful contribution and for sharing your expertise with us today. Your participation has been really valuable, and we deeply appreciate the time and knowledge that you have shared. So, thank you so much for joining us today, Dr. Piyush.
Thank you, Dr. Sumedha. It was a real pleasure, and I hope your audience would benefit from these particular points. Thank you.
You're welcome, Dr. Piyush. And in the end, I would like to mention our viewers to stay tuned as we have insightful session coming up on genetic testing, risk assessment, and innovative treatment options for the breast cancer. So thank you so much, everyone, for joining us today.